Hi, I'm Ashlyn Krokelis. October is Breast Cancer Awareness Month, a chance to learn more about a disease that affects nearly 20,000 Australian women every year. 1 in 4 women diagnosed with breast cancer in Queensland is treated at a Mater hospital. Today, we're taking you on a special tour. But first, let's hear from one of Mater's superwomen with breast cancer.
My name's Mel. I was diagnosed with breast cancer in August of this year, and things have been quite full on, obviously, since that time. There's a lot to take in, and the team at the Mater have made sure that I've been supported throughout that time and that I've understood what's happening at each step along the way as well.
I'm here with clinical nurse consultant Ash Mondolo. Ash, can you give us an overview of the range of care that people receive here at the Mater Private Breast Centre?
We meet about 700 women a year with breast cancer when they're initially diagnosed. We support them as a team, as a multidisciplinary team, throughout their treatment, surgeries, radiation, chemotherapy, the whole continuum of breast care. And we love doing what we're doing.
As we navigate our way through the hospital, we're now at Mater Pathology, where I'm joined by pathologist Rowan Lowry. Rowan, can you tell us about the role you play in diagnosing and treatment as well?
Sure, so we diagnose cancers from tissue that patients give us. And so for a woman with breast cancer, we'll make your diagnosis, we'll examine your cancer and tell you what kind of cancer that is, what kind of treatment you might need. And then the machine behind us is really important. It will look at your DNA and tell you about your risk of cancer, and then potentially talk about risk in terms of other family members.
I'm now with Mater's Director of Medical Services and breast surgeon, Dr. Chris Pike. Dr. Pike, of course, a breast cancer diagnosis is something that no one wants to receive. If they do, what sort of care can they expect to receive here?
If they come to the Mater, they can expect to receive high quality, nurturing care from end to end, from the very moment of diagnosis to the first appointments with the specialists, through their surgical treatment, through their medical oncology. They can expect support all the way from all the levels involved: specialist care, nursing care, allied health, and the support of the Mater in general.
Straight after surgery, patients come here to Level 10 North of the Mater Private Hospital, Brisbane, and one of the nurses they might meet is Olivia. Olivia, what is it like for patients when they first arrive here on the ward?
So it's a very difficult time for patients, so we offer the support and compassionate care to help them and their families. It's very individualised with each patient, so it's important for us to recognise that and attend to their psychological, emotional and physical needs.
We've now moved to the Mater Cancer Care Centre, where many breast cancer patients come to receive treatment. Esther has been with Mater for more than 20 years. Esther, can you tell us about your role here at the Care Centre? You must get to know a lot of patients.
Sure. Throughout a month we get between 12 to 14,000 patients coming into our centre across various walks of life and demographics. They each bring with them their own unique story and circumstance, and one of the most amazing and beautiful parts of our role is that we get to know those patients and we get to work with them to empower them and partner with them to offer holistic care to ensure that that patient in that incredibly overwhelming and stressful time of their life is able to feel like they're supported and can engage in a partnership with us as their cancer care teams.
This here is the gym at Mater Private, where physiotherapists like Phoebe here and the active rehabilitation team work with patients after their treatment and surgery. Phoebe, what sort of physio do patients need?
Physio is such a great way for patients to ease back into their everyday movement activities and achieve their post-operative movement goals. It's also a really great checkpoint to assess for any restrictions in shoulder range of movement, and also just to screen for any common issues that can arise.
Here at Mater Health and Wellness, there's a number of different allied health professionals like dietitians, psychologists and occupational therapists like Caitlin. Caitlin, can you give us an idea of the holistic care that's offered to patients who are undergoing breast cancer treatment?
Yeah, the Mater Health and Wellness Clinic is a great hub for patients to come to during their treatment. We offer a broad range of services that can assist ladies with a range of concerns, including diet, exercise and emotional wellbeing. One of the services we're really proud of is our lymphedema early detection service. We can offer screening for lymphedema after their operation and early intervention for those that do develop lymphedema.
I'm back outside Mater Private Hospital, Brisbane, with Director of Clinical Services, Tracy Hutley. Tracy, what's the most important thing you'd like Queenslanders to know during Breast Cancer Awareness Month?
Yeah, so during Breast Cancer Awareness Month, we encourage everyone to be breast care aware. This includes checking your breasts regularly and having a mammogram every 2 years. Early detection is definitely the best prevention.
Thanks very much, Tracy, and thank you for joining us on this tour today. If you'd like to find out any more information during Breast Cancer Awareness Month, please head to Mater's website.